So, Ahmed, Marwan, Muhammad, Wahish.
May I share my screen now, Miss?
So just a minute. Now you can share.
Okay, can you see?
Yes.
Okay. Mohammed.
Okay. What does a patient-centered approach in history taking mean? I'll start with the definition of patient-centered care. It is a model in which provider partners with families to identify and satisfy the full range of patient needs and preferences. To expand this definition, patient-centered care is dependent on the involvement of the staff and care team as well. To succeed, a patient-centered approach to succeed, a patient-centered approach must also address the staff experience and staff ability, and inclination to effectively care for patients is unquestionably compromised if they do not feel the care for themselves. Purpose of patient history taking. I'll mention 6 points. First, to identify current problem and diagnosis, exclude life-threatening and conditions, identify medical problems, progression of patient inward, response to treatment, and any complication to the patient.
Marwan. Marwan. Okay. I'll read this point. So the importance of patient-centered care in history taking. A key part of patient-centered care is you becoming involved in your healthcare, which is a key factor in history taking. The doctor will encourage the patient to express what is most important to him or her, and facilitate the narration of the patient's story. This means you choosing to be included in all decision-making, healthcare planning, and goal setting. Doing this can actually improve your healthcare. So your healthcare professional should give you all the information you need to make informed decisions for, i.e. your history. You should be given time and opportunities to ask questions and talk to your carers, family and friends before making these informed decisions. So in situations where many treatments are needed at the same time, being actively involved in your care will help you and your healthcare team to plan and prioritize your treatments by taking details of a patient's history. This helps everyone know and understand what is happening and why. You have the right to be treated with respect and dignity. This includes respect for your privacy and the confidentiality of your health information when taking a history test from your medical health professional. Marwan? Is Marwan present?
1 minute, sorry, Ahmed, I was in a toilet. I didn't hear your voice.
Okay.
So I begin from here, right?
Okay, yeah.
Okay. So 1 minute. You have the right to be treated without discrimination based on your age, gender identity, and sexual orientation, and disability and employment status, and culture, background, or religious beliefs. Healthcare should be delivered in a way that respects all your beliefs, particularly those related to treatment options, and dietary needs, and the gender of the person treating you. And respect in the healthcare setting also includes healthcare professionals and services, and trying to arrange your appointment times to fit in with your needs and lifestyle. Next slide. This is all. Okay. how a patient-centered history taking is conducted. When a doctor asks a specific, often closed-ended and question in order to help make designated. Unfortunately, this is approach often results in a incomplete or inaccurate details and limits the ability of a doctor to establish rapport with a patient. However, a patient-centered interviewing focuses on the personal and emotional context that encourages the patient to the spontaneously describes his or her symptoms. The interview efficiently establishes a relationship with the patient by focusing on the patient's emotions and concerns. When integrated with more traditional clinicine-centered interviewing, patient-centered interviewing enables the interviewer to obtain a more complete physical story. Unfortunately, many healthcare providers still use an exclusively clinicine-centered style that describes patients from expressing their concerns. That data collected are skewed toward physical symptoms and often misinterpreted because of missing physical contacts and contracts and interactions that encourage patients to freely express their concern, yield more valid data and tend improve patient satisfaction, complaints, knowledge, and recall they better blood pressure and diabetic control, better parental outcomes, shortened and length of stay, and improved mortality, and critically ill patients and improve cancer outcomes. That's all right. Ahmed, okay.
Thank you for listening to our PPT. Did you have any questions or opinions about the PPT?
Thank
No,
you.
thank you.
So I see there are no questions. Well, if we go back to our, so just criteria with them. So can you see the slide of my presentation? It should be.
No.
Well, so and now so about the evaluating the presentation, just who would like to say your opinion? So what you like in this presentation, what you would recommend. So can we listen to example? Yes, please. No volunteer.
Can
Your name?
Zainab.
So please.
I actually like the presentation and like the visuals. They helped to illustrate the main points that they discussed about, and I think it was like discussed in a good or in a appropriate manner. and I understood the main point of the PowerPoint.
Mhm. Any recommendations?
No, I think it's good.
Mhm. Okay, okay. So any more people would like to say something? Mhm. Well, so my impression from the presentation is similar to the ideas from my thoughts from the first presentation, because you can see that the same, just minuses, like too much text on each slide. So, and sometimes I see that the student doesn't understand what he is reading about. Yes, just you should spend just more time on the preparation. I mean, how to read the words that are given on the slides, because you don't recognize them well. And so what I liked is that the presentation starts with the definition of the term, this patient-centered approach. And yes, I agree that there were some illustrations that can help us to understand what the presentation is about. At the beginning, there was the attempt to avoid this just long reading with just some bullet points that you've divided the text into several chunks, just to help us visually understand what you are speaking about. And as for the content of the presentation, so what I liked is there is information about patients' rights. So it's very useful as far as a lot of we are sometimes patients in the hospitals, and about the best way of dealing with patients from the point of view of a physician, of a doctor. So to put the patient in the center of all the procedure. Well, I would recommend to use more visuals because the last slide were not illustrated with anything. And because just long text, they scare the audience, and so people don't like. Just you should do. It's better to make more slides with shorter texts than one slide with a long text on it. So, well, thank you for this presentation. And so we agree that we'll listen to the third presentation next class, right? So we'll start with the presentation. We'll listen to it at the beginning when Buse is able to join us. Well, so I hope that this assignment was useful, just especially the second just topic, the second project about this the patient-centered approach. Well, and now let us, can you see the slide? Hello, guys.
Yes.
Okay. Well, now we are going to start the second unit of the book, which is called Working in General Practice, and we'll be speaking about people who work in hospitals and with patients. And here you can see several pictures that illustrate the medical jobs. And the question, can you predict what each person's job involves? And you can see 4 pictures and 4 names of jobs here. So let us just try to match the pictures and the names of the jobs. Marwan, what is the first picture? What kind of job does it illustrate?
Yes, doctor. First picture. It's I think reception,
Receptionist.
receptionist,
Reception.
receptionist.
Mhm.
Yeah.
What does the job of receptionist involve? What do you think?
To make appointment with doctors
Mhm. Okay.
and to make yes. I think
Okay.
this is the main.
Yes, getting information from the patients, right? Mhm.
Yeah, of course.
Okay. Well, so Mohammad Wahish, the second picture, picture B, what kind of job is it?
Health visitor.
Health visitor, yeah. And so what are they doing here in the picture, and what does this job involve, judging by the name of the job?
I think she's asking questions related to her case.
Yes, where are they? Are they in a hospital, in clinic, or where?
Seems to be a hostel or a home.
Yes, so, and this person, as we can see, should visit the patients who can't go to the hospital. Yes, so some disabled people, so who have problems.
Yeah, she's a specialist nurse that, yeah, as you said.
Okay. Well, Ahmed, what about picture D? Or C? Sorry, ABC.
I mean, C is a general practitioner.
So, what are his responsibilities?
Is to provide care for the patient and within his expertise or specialty.
Okay, yes. They work with patients in hospitals, right? Well, and Zena, what about the next picture? Zena, hello?
Yes.
What about?
Since it's the last one, I think it's a midwife.
You're right. And what are her responsibilities?
I think she helps the doctor, like mainly she helps the doctor with giving care for the patient.
What kind of patients?
Maybe
so you can see the patient in the
I think pediatric.
Yes. Yeah. Okay. So newborn children. Yeah. Okay. And so if we move to the next slide, we can see more pictures. Just 3 more pictures, and let us focus on the responsibilities of these people. So Ala, are you here? Ala? No. Dilara?
Yes, Dr. Alaz here, I think.
So Dilara, will you speak about picture E, please?
Picture E is, I think, a district nurse.
District nurse, yes. What does she do? What does her job involve? What do you think? So who can help us? District nurse.
Maybe provide care to housebound patients by performing regular home visits.
Okay. So, well, Bire,
Yes.
picture F.
Um,
What's his job?
practical manager.
Practice manager.
Yeah.
And so is he a doctor?
No.
So, but he
Yes.
works, he is not a doctor, yes, but he works in a hospital, right? He
Yes.
helps to organize the practice of general practitioner. Okay, and as
Can
you
I
know,
answer?
yes, your name?
Alia.
Alia, please, yes, one picture G.
Um,
Mhm.
it's a practice nurse.
Okay, and what are her responsibilities?
They usually assist in like general surgeries, and they deliver care to like general practice.
Mhm.
Yeah, that's it.
Okay,
And like they work with doctors and pharmacists or
exactly.
dietitians, so on.
Yeah, right. Okay, thank you. So these are some of the jobs. So the people of people who work in general practice, and the question: what do you think is the most stressful aspect of medical work? The most stressful. Any ideas?
Can I?
Your name,
Zaina.
Zena, please.
I think that like the responsibility is the main stressful aspect of medical work. Like the doctor or a nurse or anyone that is in the medical field mainly gets stressed or nervous because of the responsibility that is placed upon them. Like
Okay. It's just
that's
a big pressure, right? So you are
yeah,
responsible for the lives and health for your patients.
yes, exactly.
Mhm. Okay, any more ideas? I see. Okay, and the second question is, what is the most rewarding aspect in
Can I
medical
answer?
work? Your name?
Alia.
So please, Alia.
I think the most rewarding thing is helping people overcome like the pain they're in, or finding solutions to problems they have on a daily basis, or things that affect their life greatly. So I think that's very rewarding, to make someone's life a little bit easier.
Exactly, yes. If you can help these people, and so it's you can do it successfully. This is very just inspirational thing. Yeah. Well, and so we've just looked at the jobs of medical jobs on the previous slides, and so one more time, just to remember: receptionist, health visitor, general practitioner, midwife, picture D, then district nurse, practice manager, and practice nurse. So these are the jobs. And the task here on this slide is to add the job titles of the people who work in medical jobs to the sentences. For example, the first sentence here is about, yes, a practice is run by whom? Practice is run by, what is the job title here?
Practice manager.
Exactly, practice manager, who is not a doctor, but who is a manager who organizes all the procedure. Okay, let us have a look at the second line here. So, and let us listen to, well, Ezginur. Read it, please.
work with individuals, families, and groups like the elderly and newborn babies in the community. Health visitor.
Well, right. So elderly people, newborn babies who can't visit the hospital themselves. Yes, this is health visitors. Okay, number 3 is for Mustafa.
Need very good interpersonal skills because they are the first contact people have with the practice receptionist.
Exactly. Mhm. Well, the next is for Jeren. Jeren, hello. Jeren is not here, so Marwan, please.
Yes, doctor.
So
Uh,
number 4, please. The problem with the internet. Can you hear me? Hello. Hello, guys. Can you hear
Yes,
me?
we can hear you.
So Marwan has problems. So Mohammad Wahish, will you read sentence number 4, please? Mohammad.
Yes, okay. 97% of UK population is registered with a
Yes.
uh,
With the doctor. And we call this job. What do we call this job? Who can help us?
GP.
GP, exactly, general practitioner. Okay. And so the next sentence is, Marwan, are you here? Marwan. Okay. Marwan, can you hear?
yes, doctor. I'm sorry, I have bad connection with
Can
internet.
you read sentence 5, Marwan, now, please?
Sentence 5. Okay. The duties of wait. This is vocabulary. What should I put here?
One of the jobs,
the
medical
du-
jobs. So you should
wait.
the
I
sentence
put,
first.
include traditional nursing skills and running specialties clinics for immunization, debates, and so on.
So what kind of, this is nursing skill. It means that this is nurse, right?
Mhm.
What kind of nurse?
Skills and okay. I think it's
This one.
practice nurse.
Practice nurse. Okay, so let us pause for 10 minutes. Yes.